Hydralazine, also known by the brand name Apresoline, is a direct-acting vasodilator that is primarily used to manage high blood pressure and heart failure. Hydralazine is used to treat moderate to severe hypertension, particularly in hypertensive crises. Manage chronic heart failure, often in combination with nitrates like isosorbide dinitrate, especially in patients intolerant to ACE inhibitors or ARB. Control hypertension during pregnancy, particularly in pre-eclampsia and eclampsia, where it is considered relatively safe. Hydralazine acts by directly relaxing the smooth muscle in arterioles, leading to decreased systemic vascular resistance and reduced afterload. This helps improve cardiac output in heart failure. However, it can also cause a reflex increase in heart rate and cardiac output due to sympathetic activation. Importantly, it does not significantly affect venous vessels. For oral treatment of hypertension, the usual starting dose is 10 mg 4 times daily for the first 2 to 4 days. This may be increased to 25 mg 4 times daily during the first week. The maintenance dose ranges from 50 to 100 mg 4 times daily. The maximum recommended dose is 300 mg per day. For hypertensive crisis, hydralazine can be given intravenously. The usual bolus dose is 10 to 20 mg, administered over at least 1 minute. This can be repeated every 4 to 6 hours as needed. Alternatively, a continuous IV infusion may be started at 0.5 to 10 mg per hour, depending on the patient's response. For heart failure, hydralazine is usually given orally, at 25 to 50 mg, 3 to 4 times daily. It is commonly combined with isosorbide dinitrate in a fixed-dose combination such as Biddle. Dose adjustments may be required in patients with renal or hepatic impairment. Common side effects include headache, dizziness, palpitations, flushing, nausea, nasal congestion. Serious adverse effects include drug-induced lupus-like syndrome, particularly at doses exceeding 200 mg per day. Peripheral neuropathy, agranulocytosis, myocardial infarction or angina, due to reflex tachycardia, severe hypotension. Hydralazine is often combined with beta blockers to counteract reflex tachycardia. Additive hypotensive effects may occur when used with other antihypertensives or diuretics. MAO inhibitors may potentiate hydralazine's effect. Non-steroidal anti-inflammatory drugs may reduce its antihypertensive efficacy. Guanethidine's action may be diminished when used with hydralazine. Use hydralazine with caution in patients with ischemic heart disease due to the risk of angina or myocardial infarction. Monitor for signs of drug-induced lupus, especially with prolonged therapy. Renal function should be monitored, as accumulation may occur in renal impairment. Watch for hypotension and reflex tachycardia, particularly in sensitive individuals. Hydralazine is considered relatively safe in pregnancy and is commonly used in the management of pre-eclampsia and eclampsia. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.